Hi, welcome to the app for iRadiate3D. You will be using this app along with the Phantom to practice positioning for intraoral radiograph. Adjust the phone position to make sure that it matches the correct jaw position, either the right, center, or left side corresponding to the teeth position listed. Please select the correct mode according to what was assigned to you, either mode A or B. Please attempt the exercises in the sequence listed in the instruction sheet given. The first one is the periapical of teeth 1-4 to 1-6. Select the correct holder. Next, position the holder inside of the Phantom for the periapical or bite wing radiograph. Remember to use the principles taught in the lecture. Please have the teeth bite on the black line on each bite block. If you encounter an error that shows not detected, tilt the holder label closer to the mirror until the error message disappears. Your goal is to capture images that are as close to the reference image as possible. Once you think the position is correct, press capture. After capturing, you may see two icons in red appear. This one means that the teeth of interest are not fully captured. This one means that the horizontal angulation is incorrect, resulting in proximal overlaps. These icons will only tell you that the errors are present, but not the direction of the errors. Before moving on, try to relate the position of the holder in the mouth to the image that was captured. Think about whether the image is acceptable or how the image can be improved by changing the holder position. You may click on the refresh icon and reattempt as many times as you want. Make sure that both of you have a chance to attempt the same position before moving on to the next one in the list. You may move on to the next position by clicking Next.